Good day everyone, I'm Marinel Valera and today I will discuss arteriosclerosis and atherosclerosis, two major contributors to cardiovascular and peripheral circulation arterial disorders. So first, let's define arteriosclerosis and atherosclerosis. Arteriosclerosis is the general term for hardening and loss of elasticity in arterial walls, and atherosclerosis is a type of arteriosclerosis with plaque buildup in artery walls. So, the buildup consists of fats, cholesterol, and other substances in and out of the arterial walls, and the buildup is also called plaque, and the plaque can cause to narrow the arteries, blocking blood flow, and this plaque can also burst, leading to blood clot. So next is the prevalence. Atherosclerosis is a leading cause of vascular diseases worldwide. So its clinical manifestation includes ischemic stroke, ischemic heart disease, and peripheral arterial diseases 1. So in high-income countries, there have been significant declines in the incidence and mortality from ischemic stroke and ischemic heart disease. However, in low and middle income countries, there have been more varied, with some reporting declines and some reporting increase. Next, the signs and symptoms. In early stage of atherosclerosis is often asymptomatic, meaning there are no noticeable symptoms. But as the disease progresses, symptoms depends on the affected arteries. For example, in coronary arteries, angina, arrhythmia, and shortness of breath. In cerebral arteries, weakness, numbness, speech difficulties, and stroke. In peripheral arteries, cold extremities, claudication, and non-healing sores. Next is the pathophysiology of atherosclerosis. First, let's look at the risk factors. Atherosclerosis often starts with factors that increase the likelihood of developing high cholesterol, high blood pressure, or diabetes. These include genetic predisposition, smoking, unhealthy diet, lack of exercise, and chronic conditions like diabetes. These risk factors increase the chances of dyslipidemia, an imbalance of cholesterol levels in the blood, leading to the development of atherosclerosis. Next is the endothelial damage. The endothelium is the inner lining of the blood vessels, and damage to it is a key event in atherosclerosis. This damage can be caused by smoking, high blood pressure, and diabetes. The damage makes the artery walls more permeable, allowing cholesterol particles and other substances to enter the artery walls, which sets the stage for the development of plaques. Once the endothelial cells are damaged, low-density lipoprotein or bad cholesterol begins to accumulate inside the walls of the arteries. Over time, LDL gets oxidized. This process is key to the development of atherosclerosis. Oxidized LDL triggers an inflammatory response that causes further damage to the vessel's wall and attracts immune cells like macrophages. Here comes the inflammatory response. The oxidized LDL triggers the immune system to send white blood cells called monocytes to the site of injury. These monocytes enter the artery walls and differentiate into macrophages. The macrophages engulf the oxidized LDL and transform into foam cells. This marks the formation of fatty streaks, which are the earliest signs of atherosclerosis. With continued accumulation of foam cells, fatty streaks evolve into larger, more complex structures known as plaques. These plaques consist of a lipid core and are covered by a fibrous cap made of smooth muscle cells and collagen. This plaque causes the arterial walls to thicken and narrow, reducing blood flow. This stage is often asymptomatic, but it can lead to angina or chest pain, or claudication, pain in the legs due to reduced blood flow. As the disease progresses, the plaque grows larger and becomes unstable. The lipid core inside the plaque enlarges and the fibrous cap becomes weaker. This instability makes the plaque more likely to rupture, which is a critical event. When a plaque ruptures, it exposes its contents to the bloodstream, causing the blood to form a clot. When the fibrous cap of the plaque ruptures, it leads to the formation of a thrombus or blood clot. The clot can completely block the artery, obstructing blood flow. Depending on where this occurs, it can lead to different complications such as a heart attack or a stroke. Finally, the most severe complication of atherosclerosis occurs when these plaques rupture and cause blood clots. A blocked coronary artery leads to a heart attack, while a blocked cerebral artery leads to a stroke. In the peripheral arteries, a clot can cause gangrene due to reduced blood flow. This complication underscores the importance of early detection and management of atherosclerosis. Next, the laboratory and diagnostic test. In laboratory test, it includes lipid profile for elevated LDL and low HDL, C-reactive protein for elevated and inflammation, and blood glucose and HbA1c for the assessment for diabetes risk. And for the diagnostic imaging, it includes angiography, Doppler ultrasound, CT scan, MRI angiography. So, these tests are crucial for assessing the extent of arterial damage and blood flow obstruction. Medical, surgical, and pharmacologic management. For medical management, manage cholesterol and assess for diabetes and blood pressure. For surgical management, percutaneous coronary intervention or PCI and carotid endarterectomy. And for pharmacologic management, statins, ACE inhibitors, and beta blockers. So, these medications like statins and ACE inhibitors reduce risk factors and stabilize existing plaques, thus preventing progression. Next is the nursing management. It highlights the roles of nurses in assessment, intervention, and evaluation of the patient. In assessment, we need to monitor the ischemic symptoms and vitals, especially the blood pressure and heart rate. In intervention, we need to educate on lifestyle changes and administer prescribed medications. In evaluation, we need to evaluate for improved symptoms and stable vitals and adherence to treatment. Lastly, the prognosis. With treatment, early detection and effective management can reduce risk of complication and improve long-term outcomes. Without treatment, disease progression leads to arterial damage and higher risk of cardiovascular events. So in conclusion, atherosclerosis is a progressive and often asymptomatic disease that can lead to serious cardiovascular events if not properly managed. I hope this presentation has helped you clarify the pathophysiology and management of atherosclerosis. Thank you, and I'm happy to answer any question.